is Dr. Kritika here again. Hope you're all doing fine. So what happened last night was one of my colleagues, she's a periodontist, she called me up and this is what she had to say.
I'm Neha. I'm a mother of 10-month-old baby. Now since she's 10 months, she started with her teething process. But as a mother, I have faced so much of difficulty because when her teeth started to erupt, she became very cranky. She used to cry a lot. She never used to have a proper feed. Whenever I used to give her food or milk, she was unable to have it properly. And as a mother, I was very worried. So I thought, what should I do? So I consulted Dr. Kritika.
So the first thing I asked her to do was to check if there is any kind of bulge or any kind of purplish swelling at the area where the tooth would actually erupt. And then she said yes, it was there. So between 7 to 12 months is the time when one's first tooth will erupt. It could be as less as 7 or it could be as further as 12 months or even maybe 13 months. So she said that there was a clearly purplish red bulge that was seen, and yes, what the baby had was called as teething. So what is teething first? So teething is called as that process when the tooth is trying to come out of the mouth and show its white little bit. So what it has to do is it has to come or pierce through the gums. It has to tear the gums apart and then come up. So what happens is during this process, the gums are swollen for a particular period of time that will automatically settle on its own. But when it's swollen and when the tooth ends of the gums, they rub against each other, or whenever the child rubs against these swollen gums in any part of the mouth, the child starts feeling pain or the child starts getting irritated. The other symptoms that you could see in your child is sometimes soreness, ulcers in that area. The child appears irritated as already mentioned, and in some cases there could also be mild fever or even vomiting, diarrhea. So what are we supposed to do in these kind of cases? I told my colleague to use chilled teething rings as the chillness helps to reduce the swelling.
Actually, I didn't know what are chilled teething rings, but once I bought, I realized that they are a very good option, especially when the child is having teething problems. Initially, my daughter was very worried to use chilled teething rings because whenever I used to give her, she never accepted it easily. But once she started using it, I found that she became more calm. Her crying frequency, though reduced, was not completely reduced, but she started to enjoy chilled teething rings.
Thank you, Neha. Next, even a pacifier could give temporary relief. So everything that is being done only gives symptomatic relief and is not a permanent solution. If at all, there is no improvement with the teething rings and also with the pacifiers, it is better to apply a local anaesthetic gel with the help of a cotton bud. So here I have a local anaesthetic gel. So what I have to do is I have to take a cotton bud. I have to take a little bit. So I take the area where there is swollen gums and then I apply it all around the gums. Remember that before application of the local anaesthetic gel, it should be prescribed by a pediatric dentist and should not be obtained from over the counter. If all these measures go in vain, please meet your pediatric dentist, that is a dentist who is specialized for children, as soon as possible, as he or she would prescribe a painkiller syrup if at all required after checking your child. So I hope you all understood about teething and some home care measures as to reduce the symptoms of it. So let's catch up in the next video where I will be giving some more tips on how to maintain the oral health care of your baby till he or she becomes a child, till an adolescent. Because always remember that most of the problems, dental issues that come in a child are 100% preventable. Keep watching Ask Dr. Micro Smiles. Bye-bye.